Hi there, everyone. This is Will Dupree in the KXAN Live studio. We're about to listen into a virtual press conference from the Ending Community Homelessness Coalition here in Austin. They released some results this morning from their point-in-time count, which gave us a picture, a snapshot really, of people experiencing homelessness here in our community. And it showed year to year that there was an 11% increase in homelessness here in our city. So let's take a listen as the executive director and another leader from that organization called ECHO begin their press conference.
Thank you. Sure, thanks, Chris, first of all. And first, I just want to say, I hope everyone's doing well. It's been a little while since I've talked with a lot of you. Hope your families and yourselves, I know you all are doing work each day that kind of puts you out, in areas that are sometimes less than ideal when there's a global pandemic. So I just want to check in with you all, make sure you're all doing okay and that your families are all right. And hopefully you haven't been impacted too much and you've been able to sort of stay safe and remain healthy. So I hope that's the case. Also, just want to quickly recognize, I think many of you who have reported on homelessness in Austin for some time know that this is a massive group effort, that the point in time count is just a huge undertaking that is, it's volunteer run, but it's also all the service provider communities, our city government, the city staff at Austin, our county commissioners, our county staff, a lot of folks really involved in making this thing run smoothly. But first and foremost, ECHO staff in organizing and coordinating the count. This year, Axton Nichols was our point person for that, did a really great job on our organization, which allowed us to have, I think, the most thorough and accurate count we've had to date here in Austin, Travis County. So I really think it's important, as many of you know, the group LIFT involved in this. And the last thing I want to say is that, I think we're, regardless of the numbers, and each year that we count anyone in this, the numbers more than zero is a year that we have to really remain focused on the task of eliminating homelessness in our community. We really shouldn't have a number higher than zero. So each year that we do, it's important for us to focus and refocus our efforts in ending homelessness here in Austin, Travis County, and across our country where it really shouldn't exist. And so I'll hand it over to Sarah if you have any opening remarks, and if not, we'll just get to your questions.
Yeah, and so before I do my opening remarks, I also just wanted to introduce Kate Moore. She is our Vice President of Programs and Planning at ECHO, and is here in case any questions, kind of programmatic questions arise. She can help in that arena as well. But I'd like to just start by saying thank you for your patience. We, in the kind of delay in the PID count data this year, as you may know, ECHO has been tapped along with the city and many community partners to help lead the homelessness COVID-19 response. And that's really been kind of an all hands on deck situation. And some of our analysts were tapped to assist with modeling. And we have been sharing some of the data behind the scenes with decision makers and leaders to help toward the COVID response. So it hasn't been a complete black box for the last couple of months. But as you may know, people experiencing homelessness are particularly vulnerable to contracting COVID-19 and experiencing dangerous complications from it. So we've been really working to put protections in place and safe lodging for people experiencing homelessness. And Kate and Matt have both been working very hard on that effort. So this year, our volunteer surveyors recorded an 11% increase in the number of people experiencing homelessness. And that was on January 25th, 2020. So that is one day in time in 2020. And so that does include a 45% increase in the unsheltered population and a 20% increase in the sheltered population. At the same time, along with these increases, our community partners in ECHO moved more people into housing last year than ever before. We moved 2,171 people into a variety of different permanent housing opportunities, and that's up 25% since 2017. Yeah, so really what our findings this year highlight are the need to scale up and expand permanent housing options for people in Austin and Travis County. We know that Housing First programs work. We know that they're effective and they're cost efficient. The research tells us that. And we really need to create more of those housing opportunities to meet the existing need in our community. And so this is the first PIT count since the city decriminalized homelessness. We definitely support this effort. ECHO supports that effort because it helps to bring people out of the shadows. It allows service providers to pinpoint services and resources where they're needed. And it's important, you know, that that population be visible so that we can count them, find them, serve them, help them, and get them housed. But I also want to note that our per capita rate of homelessness is roughly the same as it was a decade ago. That proportion or that percentage of the population has remained fairly constant. The last few years, we have seen an uptick in the count and a corresponding, and we feel that that is because we've had more volunteers each of those 3 years. And this year in particular, we had improved survey methods. We had a digital survey that helped us count people more quickly. It helped us get better response rates on the survey questions. And it increased kind of the proportion, the number of people experiencing homelessness that each volunteer could count. We also subdivided our sections from 36 sections to 74 sections. And that really helped us to get a more granular count and a more systematic survey of people experiencing homelessness, at least the unsheltered population. So while the number of people experiencing homelessness went up, the rate of homelessness over the last decade has remained fairly constant. And that really is a testament to the work that our partners are doing to house people and connect them quickly and efficiently with resources. So we thank our partners, we thank our volunteers, we thank the city. And with that, I'll turn it over for questions.
All right, first question in the chat from Melissa Gord. Her one question for the speakers: besides shelters shifting to a housing-focused model and a pipe bursting on the PIT count night, are there any other reasons you believe there is a lower count this year of sheltered homelessness?
Yeah, so I can speak to that a little bit. In that shifting, there were 2 downtown shelters that shifted to a housing-focused case management model, and that decreased the number of shelter beds available by about 130 or so. We also transitioned, we reclassified some housing that was previously transitional housing, and it was then correctly classified as rapid rehousing, and that accounted for another about 103 beds. The burst pipe accounted for about 25 beds.
Okay, great. Next up, Austin Sanders has a question about permanent supportive housing. Austin, I'll go ahead and unmute you so you can ask.
Hey, Matt, I know you addressed this at council, but I kind of just want to understand what you said. So there's this chart that shows from 2019 to 2020, the number of permanent supportive housing units decreased. So could you just kind of explain why that happened again? And then there's like another follow-up I want to ask.
Yeah, so it's not, so the number of permanent supportive housing units is not what's captured in that slide. It's the number of permanent housing units overall. So that's a mixture of a lot of different potential housing types. that ebb and flow a little bit from year to year. So rapid rehousing is a type of permanent housing that is determined by someone's need in terms of their rental assistance need and supportive service need. And so someone could spend 3 months in a rapid rehousing project, or someone could spend up to 24 months in a rapid rehousing project. And so those ebbs and flows constrict or open up permanent housing beds. And so that's what leads to the the difference that you see in the chart for permanent housing space.
And so I think you had said that it's actually kind of a good thing that that number is going down, because it suggests that people are not, falling out of permanent supportive housing back into homelessness. Is that correct?
Well, so that was so if you looked at slide 26 that went to council, and I'm not sure if it was in the press release docs, but we could through the source document, you could see our permanent supportive housing move-ins last year were lower than the move-ins the year before. And that is a testament to programs that are keeping people in the permanent housing program for longer. And so that we didn't have a change in our permanent supportive housing stock really year to year. We don't see much change in that. So we don't have permanent housing programs we haven't had many over the last couple of years that I can think of that came to be, and we haven't had many leave. And so really what you're seeing is when you see that the number of move-ins to permanent supportive housing has gone down, that just means that there were less exits to out of the permanent supportive housing programs.
Okay, thanks. I just want to ask one more thing about this real quick. Do you have any way of projecting how much permanent supportive housing there will be, like by the end of the year or within 6 months, something like that?
Well, I think what we're doing really hard is pushing for for increases in permanent supportive housing. So when we look at I can tell you that we're pretty certain that the federal our COC funding is not going to include new permanent supportive housing stock. But for instance, if we're able to get the Pay for Success project launched this year, and I know COVID has complicated that, but that project is 250 units of permanent supportive housing that would be new to our community. And so I think we're really looking and pushing in a lot of different directions to increase that housing type, because I think that's, we are lacking that housing type here in Austin, Travis County, but there's not a good way to predict what will come online until it does. And there's a lot that we're working on though.
All right, next question. This is obviously a challenging time for those who are homeless. Can you talk about the challenges shelters and services have faced, and what is being done to help those who are homeless through this time?
Sure, I'll take the first stab at that, but that is a loaded question. I think what we've learned right now, and what we know is that congregate settings are not the best places for people experiencing homelessness right now, or for anyone right now. And so our shelter systems have done, a really good job of decompressing, the shelters. So we've had to change our census in our shelter systems in order to be able to maintain appropriate social distancing, in order to ensure the safety of the people who are in the shelter spaces. And then many of the shelter providers, Front Steps and the Salvation Army included, have then begun providing case management services at the protective lodges, which are the hotels that we're moving a lot of the folks out of the shelter system or other people experiencing homelessness into, so that they can practice good social distancing and have access to much needed hygiene and food resources. And so our shelter providers have really stepped up in a lot of different ways during this time, as has our whole community, just in terms of pivoting off of what their traditional congregate shelter setting was, keeping that operating at a lower capacity, and then moving those operations to many times to non-congregate spaces like hotels. some of the challenges providing supportive services. I think, many behavioral health services, substance treatment services, and mental health services are best provided or face-to-face. It becomes really difficult for our population, as you know, to use telehealth or to use other means of, accessing those services. And so our behavioral health providers have done a really great job, to the best that they can, helping to get their resources out to people experiencing homelessness during this time in ways that are best, from a health perspective. We don't want housed people are many times more likely to be transmitting, could be more likely to transmit COVID into places where we have unsheltered populations and into shelters. And so we want to be really careful about how we're approaching that. And our teams have been really good about, trying to provide as much access as they can to people during this time who, we see exacerbated symptoms because of the anxiety associated with the pandemic. So I don't know if anyone, Sarah or Kate, has anything they want to add, but it's really been a Herculean effort to date right now from everyone in our community, that all the service providers and government agencies.
I think I would just add that we've also created a really clear system as a community working together to make sure that people who are symptomatic for COVID-19 or have been exposed to somebody who's been tested positive for COVID-19, whether they're in a shelter or they're unsheltered, to get really clear access to testing and to protective lodging. And I would just add that our community, it's really been impressive, the amount of coordination that's happened from the city and from nonprofits and from our local medical providers to make sure that our highly vulnerable folks, who whether they're sheltered or unsheltered, have access to testing or have access to healthcare or have access to what they need in order to stay isolated or fed or their hygiene needs met. It's been pretty amazing to be a part of.
All right, excellent. Next question is from Molly Oak. If you want to go ahead and ask it.
Yeah, hey guys, I hope you guys are all doing well. Wanted to get your response to a couple of questions that I've gotten on Twitter, and I think it's just from people who aren't familiar with the challenges that volunteers face on counting that one night. So I think a lot of people see people under overpasses near their neighborhood, and then they see those district counts that get posted and say, well, there are way more people that I see every day that are showing up in those districts. So can you just explain just the challenges that are presented on one night in the middle of the night when it's really cold in January that volunteers are facing, and why it might show a little bit different than the day-to-day things they see when it's nicer out in May on an afternoon?
Yeah, Sarah, do you want to tackle that from just restrictive surveying pathway, or I don't know
Definitely.
What the research
Sure. Mm-hmm. Yeah, so that's a great question, and actually we do know that the pit count has limitations. I mean, we feel like we've gotten one of the best, most accurate counts of the existing homeless population in Austin, Travis County this year, but at the same time, the pit count has limitations. So there's methodological changes from year to year. There's, changes in other factors like geography and volunteers and weather that can drive, the count up or down for different populations. And one of the biggest limitations, I would say, is visibility. So per HUD guidelines, we can only count people that we can see. And so if we can't see them, we can't count them. But I think we did, and our volunteers did an amazing job of counting and finding people. That said, I think since the ordinance change, people, the population of people experiencing homelessness has been a lot more visible. And so that, is, I think, can be frustrating for some Austinites and for us, and for many people that, really are committed to ending homelessness. They understand that visibility is critical to us being able to count people and serve them. So, I think there's always going to be a little bit of a disconnect between what people see on a day-to-day basis and the numbers when you get down to counting with a really specific methodology. But I think that's probably always going to be the case, no matter how thorough we are. But that said, the visibility, it doesn't count informally sheltered populations. So if you were homeless and you spent the night in a hospital or in a jail or on someone's couch on the night of pit count, you would not be counted in that population. So, there's been research scientists that have done studies. Dennis Culhane is one of them, came out with a study in 2020, estimating that you might be able to add 40% to that unsheltered count and get a more accurate picture of the true unsheltered population that are kind of informally sheltered.
Yeah, and so I would just add to that I think it's something that you're obviously the weather and the time of timing of everything, it factors in. I think one of the things that you might say to folks who are driving around in the middle of the afternoon and see people experiencing homelessness who are unsheltered on their on the street, those folks might go to shelter later in the evening that day. That's why we do the count at midnight, or start the count at midnight or 1 o'clock in the morning and count all morning, because the folks that we're counting that are out are unsheltered, and we know that they're not seeking shelter that night because they're they would be there already. And so I think that that's also part of the dynamic at play, is that during the day you're going to get more visible people experiencing homelessness out there than you are in the evenings.
Okay, great. Next question from Chris Neely. Since 2014, the sheltered population has steadily decreased and the unsheltered population has steadily increased. This is more than just a one-year drop in sheltered and rise in unsheltered. Please explain that trend.
So Chris, that was from 2000. What, can you repeat that from?
Yes, since 2014, the sheltered population has steadily decreased and the unsheltered population has steadily increased. This is more than just a one-year drop in sheltered and rise in unsheltered. Please explain that trend.
Yeah, I would say that's not what I see in the data. I do see a drop from 2014 to 2015, then an increase in 2016, a drop in 2017 and 2018, then an increase in 2019, all those slight. So I'm not sure that I see the same, not sure I see it in that same way. I think that, I will say that I think that Austin has a high number of, as compared to from the sheltered and unsheltered population. I think that we have a higher percentage of unsheltered population than other cities do. I think that needs to be addressed for sure, but I don't see the same correlation to that number.
Hey, can I jump in here for a second? It's Chris from Community Homelessness.
Hey, Chris.
Hey, yeah, no, the line chart that that you guys published, that orange, that's a downward trend from 2014 to 2020, just like the blue line graph is an upward trend from 2014 to 2020. So, it's certainly trending downward, the shelter population, just as the unsheltered population is trending upward. We do have some, outliers for single years, but generally it's dropping.
Yeah, I think one of the things just to mention about the unsheltered count is that, we're certainly, I think, over time getting better at the physical act of the point in time count of organizing and getting volunteers and counting people experiencing unsheltered homelessness in our community. And so that increase is related to that count, to organizing and to being more efficient and effective in our count of people experiencing homelessness. And I think that the stagnant nature essentially of the sheltered number probably has a lot to do with us not creating new emergency shelter and focusing more on permanent housing than emergency shelter, which I think is good for our community and something that I think when you're looking at it, allocating resources to end homelessness, you want to try to really focus on permanent resources and permanent housing opportunities for people.
Yeah, so I would just add, in looking at slide 25 from the work session presentation, that shift in resource capacity, one thing that ECHO has kind of brought to the community is a shift toward a kind of a housing first model. And the housing first model, it's an evidence-based model that shows that, housing people first, removing barriers, and getting them quickly into permanent housing and sometimes permanent supportive housing, it's effective. They remain housed. Studies show that between 75 and 91% of people remain housed. They're also cost efficient. So we know that another study showed that, because people use fewer emergency services like hospitals and emergency shelters, the emergency departments, jails, they actually, when they're in permanent housing, they use about $23,000 less in resources per year than they would if they were just bouncing around shelters and in emergency departments and things like that. So we know it's cost efficient. And I think that this slide is kind of representative of a shift in the trend and a shift in the thinking in our community around that.
All right, thank you both. Next, we have two questions from Christian Flores. The first one, opponents of the sit, camp, lie ordinance point to the 45% jump in unsheltered homeless population as proof of why the ban needs to be put back in place. Can you explain why the per capita population count is more indicative of the situation than the 45% jump?
Sure, so again, I would direct you to the slide. Let's see, what slide is this in our presentation? It's slide number 7. You can see that over the last 3 years, our increase in volunteers has been associated with an increase in our ability to count unsheltered people. So is homelessness increasing in Austin, or are we actually getting a more accurate count? We think that we're getting a more accurate count of the existing homeless population. So that's one piece. But putting the ban back in place and putting people back in hiding is not going to address homelessness. It's just going to put the same number of people behind the trees and really hamper our efforts to get people into our HMIS database and into our coordinated entry system so that they can be connected with housing resources and get off the streets.
Yeah, and Christian, I know your mic's not working, so I want to I know you won't be able to reply to this, but I want to make sure really clearly within the language, like, so we're not reporting that there's a 45% increase in unsheltered homelessness in our community. I want to make that really clear. That's the PIT count will tell you that that's what happened when we counted folks in one night, but ECHO doesn't believe that from 2019 to the 2020 PIT count, we've seen an increase in 45% of unsheltered homelessness in our community. So that's not a jump in that. And I want to be really clear when we're talking about this, because I do think this is a really sensitive topic. For people that think seeing an increase in unsheltered homelessness is a good reason to put a camping ban in place, those are folks who don't believe that housing is a human right and that people should have access to housing as a basic need and necessity in their lives. And I think that there's a real philosophical difference in opinion and in the way that we think, that ECHO thinks that people should be treated as human beings. And so I don't believe that a camping ban is going to solve, like Sarah said, for unsheltered homelessness. And in fact, the fact that people would correlate increased unsheltered homelessness with the camping ban restriction, or the decriminalizing of homelessness is what that communicates to people is that folks that are experiencing homelessness choose to be there, and that it's their choice, that they've decided, now I can sleep on the sidewalk. I'm going to choose to do that instead of getting access to a housing unit. And I think that that's not a correct assumption to make. And the data doesn't back up that assumption. And so I just want to be clear about that. And I know that you're typing and you might be on the road somewhere. And so I just want to make sure that from a language perspective, that's not what ECHO is reporting.
All right, thanks, Matt. Second question from Christian. How important will it be to get the motel conversions going, and what differences could we see if the city buys the motels that they want?
So very important. I mean, we have a real shortage of permanent supportive housing in our community, and the motel conversion is one way that will work to address that shortage. It's one of many ways that will work to address that shortage in our community. I think our community partners are always looking for different ways to increase their permanent supportive housing stock, increase access to resources for people experiencing homelessness. The motel hotel strategy is one way that can work. And there are a lot of other ways, I think, that our community will work to build up permanent housing resources for people experiencing homelessness. In terms of what differences that we'll see, I mean, I think that clearly, the visible nature of unsheltered homelessness in your community, will that change? I think we'll need to see a significant, really significant resource commitment on a lot of levels to really change visibility of people experiencing homelessness in our community and in communities across the country. There's a lot of cities that have really high numbers of unsheltered people experiencing homelessness right now that are growing by the day. And I think it's going to really take a significant resource commitment to see that change.
All right, thanks, Matt. Next question comes from Mark Wilson. Have you seen any increased demand for services through the HMIS since the pandemic began? What kind of spike do you expect to see, and what preparations are being made to help handle increased need?
So, Mark, that's a great question, and something that we need to look into in terms of HMIS. But if we've certainly our partners, and I would encourage you to reach out to, LifeWorks and Caritas and SAFE and our partners in Integral Care. They have all sort of anecdotally reported spikes in need for services, for utility, for rental, for food, for behavioral health care services. And of course, the food bank has seen record new users. But we do anticipate a kind of a wave of insecurity because of this. Given the COVID pandemic, it would not be surprising if we saw a definite increase over the coming months and even years in people both at risk for homelessness and falling into homelessness.
Yeah, and I'll just add, I think, we really need to make sure that people who are impacted economically through the pandemic, through loss of job or in a lot of other ways, we need to make sure they stay in their houses, in their homes. That's going to be at the forefront of our minds from a policy perspective, from a funding perspective. I think the the best way to impact homelessness in terms of, ensuring that people don't fall into homelessness is to make sure that when they're in their home, we can prevent homelessness in households, because it becomes much more expensive to treat people, to help people experiencing homelessness once they're experiencing homelessness. And if we can get to them before that, it's much less expensive, and it's much more effective and less trauma-inducing on the family and household.
All right, next two questions are from Andrew Weber. This first one specifically is addressed to Matt. Kate, maybe this is something that you want to jump in on. You briefly mentioned this at council, but how do y'all address the racial disparities in the count from an operational standpoint?
Yeah, the racial disparities exist because our country's structural racism that occurs nationwide, and Black and brown folks in our communities are predisposed to experiencing homelessness. They have conditions because of their vulnerabilities associated with our economic system, our criminal justice system, our healthcare systems, that essentially predispose them to experiencing homelessness. So it's not that the count necessarily has racial disparities. Our homeless population of people experiencing homelessness, there are many racial disparities across that population, and the PIT count just is one sample of the whole, I think, is how I'd answer that.
I can add to that too. So annually, our agency puts together for the community a disparities report. So we look at what are the racial disparities of people experiencing homelessness in our community, so that we can have that data really in front of us. It's been a priority of our continuum of care to address the inequities, the racial inequities in our homeless response system, because we're seeing this disproportionate number of people, particularly African-American households, falling into homelessness compared to other households. And this year, our governance created a racial equity task group. And that task group has really been looking at, what can we do as a community to try and address those inequities. And we're looking at things like our prioritization system that we have for our homeless response system through coordinated entry to determine if there's a way that we can address it there. We're also looking at policies and programs throughout the homeless response system. This task group is also looking at all the different programs that serve people experiencing homelessness, and how can we ensure that racial equity is addressed by each program. And it's a great collaborative effort. It includes this task group, includes people from the city, it includes a lot of people from our local nonprofits who administer programs, it includes people from ECHO. So it's become a really high priority within our community to recognize this issue and to take proactive steps.
All righty, and the second question from Andrew, given the imperfection of the PIT count, what would y'all see as a more effective way to count folks experiencing homelessness? If HUD gave y'all free reign to do whatever you want, how would you better count folks in Austin?
Yeah, Andrew, that's a good question. I think using our a combination of our HMIS system and our coordinated entry data is one way that I think provides a better glimpse into the scope of homelessness in our community. I think one of the things that we're getting better at as in terms of nationally is our data collection associated with people experiencing homelessness. I think there's a piece of when people touch our system and they have a coordinated assessment and they get entered into HMIS, if they resolve their homelessness outside of our system, which many, many, many people do, is they'll come in and then think that they're going to need some sort of long-term assistance or try to get some sort of long-term assistance through our homeless response system, only to resolve through family or friends or getting a job and moving out of homelessness, there's no way for them, nor would we expect them to report back to ECHO about, hey, I resolved my homelessness, you can take me out of the system. And so it becomes one of those things where you can have somewhat of an overinflation in certain ways that people experiencing homelessness are counted, and then the underrepresentation of the point in time count. I think that there's a lot of really smart people working on how to get a better handle on our like a grasp on our entire homeless population, even nationally. But there's a lot of work to be done in terms of refining sort of the data gathering. I think that and the tools that we're given to gather that data, not just here at ECHO, but across the country. So that's a tough question to answer. I don't know if Sarah, you want to provide any context to that?
I think I would just echo that, our HMIS system captures people that are homeless and at risk of homelessness. And our coordinated entry system captures people that are literally homeless. And so it's really, having the resources to have all of our providers participating in those databases and in the coordinated entry system, because the more providers we have and the better trained they are to actually enter the data, both incoming and outgoing, the clearer picture we can get. And that's something that we strive at ECHO and with our partners to constantly be improving data quality. So I would just add that.
All right, we got another question here from Molly Oak. What are the big things you all learned from the results? Any data that will change the way you all do things here in Austin or shift y'all's focus at all?
No, I think the point in time data this year just highlighted the fact that we need more resources here in Austin, Travis County to address homelessness. I think that's what the point in time count highlights year over year, is that we have great programs that do great work. We understand the interventions that are needed. We understand the level of service and rental assistance that's needed. We have a really good sense of that. We just, it's a continued reminder year over year that we have to work on making ending homelessness a priority for our local, our state, our federal government, and just continuing to hammer home that we believe that how access to quality, affordable housing is a human right, and that we should prioritize it as such. When we're looking at our budgets and we're looking at where to put our money.
All right, well, those are all the questions that are in the chat. I'll give y'all, we have a few more minutes here, so if anyone has any final questions, again, feel free to either put the questions in the chat or just sort of digitally raise your hand in the chat and we can get to you here in the next couple of minutes. I do want to take just this opportunity to thank y'all for being here and for asking these questions and for trying to better understand all of this data. We know it's a lot to sort through, and it's a lot to try to understand. So we appreciate y'all taking the time to really dig in and understand the data here. Again, I am recording this meeting on my end. I know a few of you are as well, but if for some reason you weren't able to, or decided halfway through you wanted to and need access to the recording, just let me know in the chat and I can email you a download link once we wrap up here. But it looks like that might be all of the questions that we have. If there's anything that Matt, Sarah, or Kate, you want to sort of wrap up with, now's the time.
Yeah, Chris, I just want to highlight what you mentioned. It's, the way that this is reported on is so important, and understanding the numbers and how they relate to our community it's really important work. And I would really encourage everyone on the call, if you have any questions or need clarity or a clarification, the language is so important. People are going to be reading about this tomorrow or listening, to clips of us tomorrow, and it's going to help form their opinions about people experiencing homelessness in our community. And I think please take the time to reach out and understand. Thank you for being on the call. And if you need any clarity associated with anything that you're going to write over the next couple of days or today, please just reach out and we'll try to get the information for you. And take care of yourselves.
Alrighty. Well, I think that will do it. And yeah, if anyone needs any clarifications as you're writing today or follow-up stories, by all means, reach out to me. All of you should have gotten my email address and cell number in the email that went out this morning with the release. So feel free to reach out either way, and we'll be happy to provide any clarification. But thanks again, everybody, for being here, and we look forward to reading and watching and listening to all your stories.
Hey there, everyone. Will Dupree once again in the KXAN Live studio. We've just wrapped up a virtual news conference that the leaders of the Ending Community Homelessness Coalition called. They released a count, or at least the results from a point-in-time count that happened back in January of the people who are experiencing homelessness in our community. And what they're saying is that it showed an 11% increase in overall homelessness, as well as a 45% increase in unsheltered homelessness compared to last year. Now, what the leaders have just reiterated and have said in their press releases they've sent out earlier today, and what we have reported on, is that they don't think there's any kind of surge in people who are falling into homelessness. They're saying that really they had more volunteers to be able to count more people, so that raised the number, as well as increased better technology to record those results from that particular day back in January. So again, keep that in mind as we're reporting on that. Our Alyssa Gord here at KXAN, she wrote a very in-depth article, lots of resources to read upon in this article on our website, kxan.com, and on the KXAN News app. You can find lots of resources about this particular bit of information that's been shared today by ECHO, the Ending Community Homelessness Coalition. We thank you all for watching for as long as you have. I'm Will Dupree once again in the KXAN Live studio. We're going to end our stream, and we'll see you back here another time.